live?
Yes, we're live.
All right, well, it's Dr. Gordon and Lynda coming at you from Southeastern Fertility. It's Facebook Friday.
Go Friday!
Go Friday. Woo! Just in time for the mail to come in. Here we go. All right. How are you?
Hello.
All right. Well, usually we get food deliveries, but today we got mail delivery.
Mail call.
That's our mail call. All right. All right. Well, Lynda, we're back. We're back from ASRM.
Yes, we are.
That's right. We have our guest videographer.
Taylor.
Yay! Hey, from behind the camera.
Turn around and show yourself.
There's Taylor. All right. That's right. Mark did return from Baltimore.
I hope so, because I haven't seen him since.
I was shopping at Walmart last night at 9:30 and ran into Mark and Dana.
Oh, okay.
Yep, so they're back.
Good to
So
know
he's back.
He's
Back safe and sound. So we were all in Baltimore, Maryland
Yeah.
for the American Society of Reproductive Medicine meeting.
Yes, we were.
And so it was an interesting meeting.
Very interesting.
Your first ASRM.
My very first.
You survived.
I did survive.
You did survive. So Lynda did describe an episode kind of like what happens at the dog park when I have taken our dogs who are very poorly socialized. And so when I take our dogs, Lucky and Belle, to the dog park, I did that with Susanna recently, and these dogs run up to Lucky and they're like, hi, are you a nice dog? I think I'll play with you. And then Lucky goes, ah, and, right? So what was your dog park moment?
My dog park moment was when I went up to someone to tell them how happy I was that they had mentioned the embryo adoption or embryo donation, and sort of pointed out that the practitioners weren't really telling patients about that as a third-party option. And she looks at me and says, you're with NEDC, you're our competition. And she stood up and turned her back to me and started talking to someone else.
That's right. Can you believe that? How rude.
She was very rude.
Yeah, sadly.
And I've never even thought about it as a competition.
That's
I mean,
right.
I thought of it as we're in the same goal.
That's right. I agree.
To get those embryos at home.
That's right. Well, and it's as unusual that way, right? When that happens, because you're like, well,
it's never happened to me
I
in
know.
the
Well, you have
oncology meetings.
oncology meetings. You don't fight over. Well, we have more cancer patients than you.
Yeah.
Right. That is certainly part of it. Is Christy back there?
Someone was back there.
Okay. All right. So there was a lot of things we learned at the meeting, and we're going to actually have a practice meeting in about 2 weeks just to talk about some of those things. But
I'm glad you gave me a heads up.
that's right. That's right. Lynda, tell us all those things you learned, Lynda. All right. So, but I thought we have a word of the day, which I thought might be sort of fun to talk about. Okay. This is the word of the day. I've been using this word a lot recently.
PESA-palooza.
PESA-palooza.
Yes.
Tell me, what is the PESA-palooza?
PESA percutaneous.
Yeah. Well, you can just kind of. I'll go through some of that.
You go
what
through
is
it.
what is a PESA-palooza? Is it a music festival?
It is not a music festival.
It is not a music festival. Is it a?
It's not a food festival.
It's not a food festival either.
No.
Okay. All right. Is it Hollywood types coming by and visiting with us here in East Tennessee?
No.
It's not that either.
Some would wish it was.
That's right, but that's not what it is.
But it's not what it is.
So what is it? Who's the star of this show?
The star of the show is, did you say the patient or the urologist?
Well, of course, but yes, but in this case, probably the urologist, since he is the consistent one across, right?
Urologist, yes.
Right. So our urologist that we work with, Ed Kim,
Dr. Kim.
Ed Kim at UT. So he has lined up just several men for PESAs in the same day. So we're just sort of calling it PESA-palooza for that reason. So essentially, right? So I thought I'd talk a little about that. So when we think about male infertility,
Yes.
there are situations where man does not have any sperm in the ejaculate.
Yes.
So, and in these situations, sometimes we have to then go upstream.
Because it doesn't necessarily mean that they don't have any sperm.
Correct. It's just not coming out.
It's just not coming
That's
out.
right. That's right. So stuff's coming out, no sperm, and what is coming out?
Right.
It's called azoospermia.
Mhm.
Okay. So there are all these sort of this alphabet soup that we have. No, I got it. Okay. So we've got TESA, we got TESA, PESA, Okay. So, but what these all have in common is this, right? Is ICSI.
Yes.
Right. So any sperm that is coming from anywhere besides ejaculate, you have to do ICSI.
Yes.
Right. So we take the single sperm and put it in the egg.
Yes.
Right. And so we've talked a little about ICSI. How,
We have a couple of weeks. Or
right, the
weeks
ICSI is
ago.
unusual,
Yes.
right? That it even
Yes.
works, right? Okay.
Mhm.
So then we have this alphabet soup of how if we have a gentleman who's had a vasectomy, for example, he should be making sperm, but the vasectomy's worked, right?
Right.
Sperm coming out, good for a birth
Which was
control.
the goal.
The goal, that's the goal,
Originally.
right?
Yes.
And so basically then we have to go upstream to see if we can get sperm,
Right.
right? So we have basically a couple of choices. You can go to the testicle, which would be testicular sperm extraction or testicular sperm aspiration. Okay, so testicular TESA is more extensive, right? So if in this situation, if you're worried that you may not have good sperm production, what is called non-obstructive azoospermia, then you probably have to do a more careful exploration of the testicle to see if you find areas where there's actually sperm production.
And is that where they take the tissue?
That's when they take the tissue. And it can be done also sometimes under the operating microscope, like Dr. Keenan when he does tool renastomoses, he does them in the operating microscope. The microscopic testicular exploration, you're looking for areas within the testicle where you might see some sperm production.
Okay.
Now you could do just sort of a needle aspiration or percutaneous type aspiration of the testicle, and that would be sort of a TESA, right? So testicular sperm aspiration,
Right.
where you're just sort of blindly going in to get, trying to get
Is
some
it hit a
fluid.
pocket of fluid?
Instead, hoping you get that right, and that usually ends up with some sperm, but not in cases where it's a production problem.
Right.
Okay. But in our guys who've had then who've had a vasectomy, then you should have good sperm production. So then the sperm is stored in the area called the epididymis. Okay, so in this case, E and E's stand for epididymis. Okay, so again, in this case, you.
Just down to help you.
That's right. So basically, so usually then it's either percutaneous epididymal sperm aspiration or microscopic epididymal sperm aspiration. So again, in these cases, MESA and PESA are going to the epididymis to get the sperm rather than to the testicle to get the sperm.
Right.
And so PESA in particular, if you've had a previous vasectomy, going there with the needle under, I think like a local block, is usually pretty successful. Okay. But sometimes you have to do it, more of an exploration of the epididymis or go upstream to the testicle. And sometimes you'll have differences, like one side will yield good sperm, the others will not.
Okay, so I have a question.
Yep.
So part of these, they do like the local anesthetic
Yep.
to numb things. What part, do they do all these in the surgery department? Or is some done in the office?
Right, excellent. So I think that, Ed, has done some of the PESA, more in the office-based setting. But as soon as you go into the more exploration, usually then you're doing it more in the hospital. Right? Certainly the microscopic explorations are going to be done in the hospital
In
situations.
surgeries.
Right.
Okay.
Now, you know how I am with needles.
Yes.
You give me my flu vaccine usually, right?
Yes.
And do I like needles?
No,
I do not.
he doesn't
Right?
like the
I
nasal
don't-
swab, Steve.
I don't like those either. Yeah, Linda's going for my see if there's any COVID in my CNS.
I just keep going till his eyes roll back.
Yeah,
in his head.
so we feel a little crunch, and that's when you're going into the sphenoid sinuses. So, just to be frank, if somebody comes at me while I'm awake with a needle in hand, going to my nether regions, I would probably say, maybe I'm okay. A different path to having additional children. Right. So I'm the wrong guy to ask, okay? And I'm just God made anesthesiologists for a reason in my book.
Yes.
Okay.
I
And
agree.
so that's the way I look at it. But not everyone's that way. Now the complication rate for these are very low. Now, did have a guy who did have it wasn't a horrible complication, but was not good, where he actually had some bleeding into his testicle after one of these procedures. And upon questioning, we found out that he had gone out and played touch football the day after the procedure and was hit.
And was not supposed to be out playing touch
And
football
would-
the day after the procedure anyway.
Not. So, there's things can happen even when you don't play touch football after the procedure, but that's probably not a wise choice.
No.
Yeah. So anyway, the one thing I do tell all the guys who do this, I said, in my book, you get a gold star.
Yes.
Right? Because, it is, let's face it, reproduction inherently unfair, right? In terms of the role of the man versus the role of the woman. But for the guys who go through these things, they are
They get
way
the gold
above
star.
that. They do,
Yes.
right? They do, and that's I think important, right? So I mean, yeah, my sympathies for the men who are having trouble doing their part. I'm sympathetic, but I mean compared to the guys who are doing this, I mean it's very different. So we're looking forward to the upcoming PESA-palooza, right? We are not selling tickets to PESA-palooza.
No tickets.
You will not
no
find it
tickets.
online. No, you can't register for it.
But hopefully plenty of police patients
Hopefully, very
that we
pleased.
can go through IVF.
That's right. That's right. And with
help out.
and we don't need lots of sperm, right? We need one sperm per egg,
Mhm.
right? And sometimes Carol and Sarah are back there for hours,
Yeah.
looking for those couple of sperm. So
Looking for the few,
the few.
or looking for the very best. If they
Exactly.
have more
Right,
than
the
few.
best. Exactly. So anyway, so I thought it was, I did go to this talk by Dr. Goldstein's a famous urologist, and he said, we've got to maintain this specialty because who will tell inappropriate sperm jokes in the operating room if not for urologists, right? And so I'll leave you with his favorite joke was, why does it take 40 million sperm but just one egg?
I'm almost afraid to ask.
Because men never ask directions, Linda, you know that.
I love it.
That's right. So anyway, and he had some other jokes which we can't repeat because they're inappropriate.
No.
Right. Well, anyway,
No,
that's
that's fine.
that's right. So we're back. Linda's back. We're full of knowledge, even more than we were before we left.
We're full of something.
That's right. We are full time. We had
We
a
did
great
learn.
time.
We did learn.
We had some good meals. We had some good fellowship. It was all very good.
Yes.
Anyway, so this is Dr. Gordon and Linda signing off on Facebook Friday. And we appreciate the people who came up at the meeting and said, we watched Facebook Friday.
Yes.
Yes, I mean, it's amazing.
That was very exciting.
I know, right. We had
We
at
got
least,
to meet Brad.
that's right.
Hi, Brad.
I Brad, so at least have at least 3 fans. So that's
Yeah.
good. Yeah. Even when I'm in front of the camera, maybe.
And we had
Maybe.
the day before.
Maybe 4.
Maybe.
All right. Anyway, y'all have a wonderful weekend. We'll be
and the
here.
World Series.
And the World Series.
Go Braves.
Go Braves.
Chop.
Chop, chop. That's right. That's right. All right. Y'all take care and have a great weekend.
Bye-bye.